İstanbul Estetik
Dr.
Forum'a
Pinar
canlı
Unal. I
yayına
have a
devam
new guest here,
etmekten
plastic and
Doktor Pinar
aesthetics
Unal, yeni
reconstructive
konuğum var
surgery
yanımda.
specialist
Plastik
surgeon
ve
Oytun
estetik
İdil.
rekonstrüktif cerrahi
We'll
uzmanı
talk about something
Profesör
very
Oytun
different.
İdil.
He's
Çok
one of the
farklı bir
medical
konudan
professionals I
bahsedeceğiz.
admire and appreciate the
Kendisi bu
most. You
konuda
are welcome,
benim en çok
doctor.
beğendiğim ve değer
Hello, glad to
verdiğim
be here.
hekimlerimden bir tanesi.
Now,
Hoş
we are
geldiniz.
used to and
Şimdi
expect from plastic surgeons
biz
to talk about
genelde
women, facial beauty, similar
plastik
things. But
cerrahlarda
there's no
hem
one talking
kadınlar,
about men. There are
cilt,
some, but so
güzellik
little. I'd like to
ve bu tip
clarify this. Men
konuşmalara
have plastic
alışıyoruz
surgery
ve
too,
bekliyoruz. Ama hiç erkeklerle ilgili konulara
but you do
değinen
things on a different
kimse yok.
scale.
Var
Can we
ama
hear a little
sıklığı daha az.
from you?
Ben
Can we
bu
hear a
konuya
little
ışık
about
tutmak
this from you?
istiyorum. Erkekler de estetik yaptırıyor. Ama siz daha farklı boyutta işler yapıyorsunuz. Bunları biraz öğrenebilir miyiz
Well,
sizden?
my line of work is a little different. To rephrase it, it goes a little bit beyond general plastic surgery. But the reason why these subjects are extreme is not because they are not very difficult or very unconventional operations. These have not been addressed much in Turkey. For example, one of the most common surgeries we perform is genital surgeries, penis enlargement, thickening, and elongation surgeries for men. There has been a lot of demand lately. The number of the patients has increased, especially in recent years. But it's interesting that in 2004, when I first performed this, I never thought that it would increase this much. In fact, after I had my first patients after the surgery, I said the rest won't come because you'd expect the patients to hide it. It's not like nose job. You do a nose job and the patient walks in the street and everybody's asking who did your surgery. But I thought everyone would hide a penis enlargement operation. I thought no one would see it and there would be no advertisement for that, but the case is different. Now I see the patients write about it on the internet, on forums. They even talk among relatives. If the patient is satisfied, he sends his relatives, brings them, and comes with his friend. So the number of the patients gradually increased, and we had more cases than I expected, especially since 2008. These are extremely safe operations. The results are really good. Since the patients are satisfied, they already recommend it to others and the number of the cases increases in this way. So, do these operations affect reproductive functions? People may have drawbacks when it comes to that. Do these operations affect or outperform them? Well, there's the thing. These operations are purely physical, not functional. So they won't alter any functions. It only gives you the penis thickness externally and elongation of up to 2 centimeters. Patients ask a lot. For example, they say, I read on website that it gives an elongation of 5 centimeters. There's no such thing. That's completely imaginary. Let's be realistic. Very rarely, sometimes the patient has too much fat deposits around the penis. And if you remove this fat, the lengthening can increase 3 to 4 centimeters. But it's rare. In general, the results can be guaranteed with elongation are around 2 centimeters. I'm talking about making it longer. For thickening, we take the fat from the abdomen and we do a fat injection around it. There are two things that limit us here. The amount of fat in the abdomen. If the patient is very thin, an athletic man, and using a substance that burns fat, if there is no fat in the abdomen around the waist, it is very difficult. We have to find fat. Let's say you have fat on your stomach, you shouldn't overdo it either. Over the years, we learned how many cc's we need to stop. If done too much, it can cause other problems. For instance, it can make it harder to get an erection. Therefore, over the years, we have learned that we must not exceed 40 to 45 cc of fat. It provides a satisfactory result in terms of appearance and doesn't distort the function. So, is there any age limit for these surgeries? Can anyone do it? You are actually asking good questions. I never thought about it. Well, honestly, there's no age limit. The youngest patient I had was about 20 years old. The oldest was 60. In fact, the patient who was over 60 was a specialist doctor. He got a penile prosthesis implantation and the patient had a penis stick, but he also asked for help for a thickening. We did a thickening surgery on a patient over 60. He was extremely happy with the results. So Actually, there's virtually no age limit with this operation. It can be done on any age over the age of 18. Prosthetic hyperplasia develops in men after a certain age. Can someone with such a disorder have this operation? Prosthetic hyperplasia, it has nothing to do with that. I ask these questions to bring up the issues that our viewers are curious about. Other than that, as a doctor myself, I've read about them. I know them. I follow these sessions, but I also ask questions from our readers or viewers because I want to meditate here, so it's not relevant. It has nothing to do with the prostate. One more thing I have to note. Now, in addition to age, they also ask, do you do this surgery only to patients with a small penis under a certain centimeter? In fact, it's not like that. For example, we had a patient now whose penis size was extremely adequate at the time of surgery. Our nurse, my surgical nurse, asked me, this patient doesn't need it. Why is he going to be operated? And my answer was, well, you shouldn't misread the patients. Patients do not come because their penis is small. They come because they want to make it a little bigger. Because with normal sized and even large penises can also undergo this surgery. Also, let me say, since we are moving the tissue from the inside out, the size of the tissue has great impact on the outcome of the operation. The bigger the penis, the bigger the result. We don't do this on patients with very small penises. We call those micropenises because this surgery doesn't provide a big gain on those patients. Now, aside from these surgeries, are there other surgeries that men have? Well, like I said, I work on different things. In men, for example, we put prostheses in hips to enlarge the buttocks. Now, it may sound very strange at first, why buttock augmentation surgery done on men? Body aesthetics have become very popular in men lately. For example, there are many men who play sports and do bodybuilding, and they have liposuction in the abdominal area to accentuate their abdominal muscles. In these patients, if the hip is flat, if the buttock part is flat, if there is none at all, you can make the hip more prominent with prosthesis. What kind of results does that give? Let me explain. I put a buttock prosthesis in my bodybuilder patient. The man's hips were flat. He built his pectoral, his arms are pumped up, abs are great, and legs are perfect. But no hips, buttocks are flat. We did the prosthetic surgery. While moving the patient to his bed, of course the patient was lying on his side, I saw the silhouette of the patient from the side. At that moment, I realized that we had inserted the part that was actually missing. The hip was missing clearly. And when I saw it from the side, I realized that we put the missing piece of the puzzle. The man's body looked exactly like a Greek sculpture. You see, I always give the example of Michelangelo's statue of David. This statue has a hip and it's very prominent. Its body is also very prominent. Its arm muscles, its pectoral muscles have very perfectly cut shape. If you remove the buttock part of the statue, there's nothing left. The beauty is gone. Do you understand what I mean? It would be incomplete. When you put a prosthesis in these patients' hips and elevate them, it becomes extremely beautiful. The contours of the body become complete. Therefore, the patients who see the outcome of these cases, especially the bodybuilders, undergo this surgery. So the number of the cases has increased in recent years. Yes, that was a very good exchange of information. Thank you so much. We touched on a different topic. Nicely said. Have a good evening. Goodbye.
İyi toplantılar diliyorum. Hoşça kalın.